वेलकम टू मेडिकल टीवर। तो फ्रेंड्स, आज जो हम वीडियो लेके आए हैं वो मेडिकल लैब टेक्नोलॉजिस्ट के जो एमसीक्यूज के 4000 टारगेट है उसके क्वेश्चन नंबर 2001 से 3000 क्वेश्चन तक लेके आया हूँ। फ्रेंड्स, तो चलिए स्टार्ट करते हैं। तो आज का जो हमारा वीडियो है वो पार्ट है बैंक, जो ब्लड बैंक है उससे रिलेटेड 50 क्वेश्चंस मिलेंगे। इसी तरीके से फ्रेंड्स, मैंने लास्ट वीडियो बताया था जिसमें आपको कहाँ से पीडीएफ मिलेगा, उसको डाउनलोड कर सकते हो, उसका पासवर्ड भी सारा कुछ उसमें बता दिया हो। अगर इसको भी अगर आपको डाउनलोड करना है तो नीचे डिस्क्रिप्शन पर लिंक दिया हूँ, वहां से आप जाकर डाउनलोड कर सकते हैं और पासवर्ड भी आपको वही मिल जाएगा। फ्रेंड्स, इतना मेहनत किया हूँ तो थोड़ा सा आप वीडियो तो देख ही सकते हैं। तो पहला क्वेश्चन है, व्हाट इज द यूनिवर्सल ब्लड डोनर टाइप। तो यूनिवर्सल जो ब्लड डोनर होता है वो ऐसे ऑप्शन है ए, ओ, ए, बी और बी निगेटिव। तो इसका करेक्ट आंसर है ऑप्शन नंबर इज बी है। ओ निगेटिव जो होता है वो यूनिवर्सल ब्लड डोनर होता है। और इसमें से चलिए नेक्स्ट क्वेश्चन, विच ब्लड टाइप इज कंसिडर्ड द यूनिवर्सल रेसिपिएंट। यूनिवर्सल रेसिपिएंट कौन होते हैं, ए बी पॉजिटिव, ओ निगेटिव, ए निगेटिव, बी पॉजिटिव। तो ये आप सभी को पता है, ए बी जो पॉजिटिव होता है यूनिवर्सल रिसिपिएंट होते हैं, ए बी पॉजिटिव और डोनर ओ निगेटिव। नेक्स्ट, व्हाट इज द मोस्ट कॉमन ब्लड टाइप इन द वर्ल्ड। वर्ल्ड में सबसे मोस्ट कॉमन कौन सा होता है, तो आंसर नंबर इज सी, ओ पॉजिटिव होता है और सबसे कॉमन होते हैं। नेक्स्ट क्वेश्चन, विच कंपोनेंट्स ऑफ ब्लड इज रिस्पॉन्सिबल फॉर क्लॉटिंग। क्लॉटिंग के लिए कौन सा जिम्मेवार होता है, तो ये होते हैं प्लेटलेट्स। नेक्स्ट क्वेश्चन, व्हाट इज द terms for the process of separating blood into its individual components, and correct answer number is C, centrifugation. Next questions, which blood type is considered the universal plasma donor। तो होते हैं ए बी पॉजिटिव। नेक्स्ट, व्हाट इज द फैक्टर आल्सो नॉन एज आर एच फैक्टर किस नाम से जाना जाता है, रोडियम, रिसस, रिनोवायरस एंड आंसर नंबर इज बी, रिसस। नेक्स्ट क्वेश्चन, विच ब्लड ग्रुप इज नॉन एज द बॉम्बे ब्लड ग्रुप। तो जो बॉम्बे ब्लड ग्रुप है वह एच ब्लड जो जिसमें एंटीजन पाया जाता है वह बॉम्बे ब्लड ग्रुप कहलाता है। नेक्स्ट, विच ब्लड कंपोनेंट्स इज द रिस्पॉन्सिबल फॉर कैरिंग ऑक्सीजन टू द बॉडी टिश्यूज। तो ये रेड ब्लड सेल्स का कार्य होता है। नेक्स्ट, in the ABO blood group system, which antigens are present in the B blood। तो एंटीजन जो पाया जाता है वही ब्लड ग्रुप्स होता है, इसलिए बी ब्लड ग्रुप में बी एंटीजेंस पाए जाएंगे और एंटीबॉडी ए हो जाएगा, जस्ट अपोजिट हो जाता है। नेक्स्ट, विच टाइप कैन अ पर्सन विथ ए बी रिएक्टिव इन अ ब्लड ट्रांसफ्यूजन, ए बी निगेटिव है ना। तो इसका जो करेक्ट आंसर है वह है ओ निगेटिव, क्योंकि जो ए बी निगेटिव होता है वह सभी को रिसीव नहीं कर सकता है, वो निगेटिव को रिसीव नहीं कर सकता है। नेक्स्ट क्वेश्चन, व्हाट इज द टर्म फॉर एन एबनॉर्मल इम्यून रिस्पॉन्स टू ब्लड ट्रांसफ्यूजन लीडिंग टू द डिस्ट्रक्शन ऑफ ट्रांसफ्यूज्ड रेड ब्लड सेल्स। करेक्ट आंसर नंबर इज द डी, ट्रांसफ्यूजन रिएक्शन। नेक्स्ट, what is the primary purpose of cross matching in blood banking। correct answer number is C, SS donor recipient compatibility। next, which blood type is considered the rarest among the ABO groups। AB positive, O negative, A negative, B negative। तो होता है AB negative। रेयरेस्ट जो होता है ए बी, यहाँ निगेटिव आएगा किंतु यहाँ पॉजिटिव हो चुका है फ्रेंड्स बाय मिस्टेक ऑप्शन, तो इसलिए इसका करेक्ट आंसर जो है ए बी निगेटिव आएगा। नेक्स्ट क्वेश्चंस, व्हाट इज द सिग्निफिकेंस ऑफ द टर्म्स एंटीबॉडी स्क्रीन इन ब्लड बैंकिंग। And correct answer number B, detecting antibodies in the recipient plasma. Next questions. Which laboratory test is performed to identify the presence of antibodies in a person's blood? And correct answer number is C, direct cum test. Next questions. What is the purpose of cryoprecipitate in blood transfusion? Correct answer number is B, provide clotting factors. Next questions. Which condition is characterized by an inadequate number of red blood cells or a deficiency of hemoglobin in the blood? Correct answer number is B, anemia. Next questions. What is the primary purpose of storing blood in a blood bank? Correct answer number is D, ensure availability for transfusion. Next, in the Rh system, if a person is Rh negative, what antibodies may be naturally present in their plasma? And correct answer number is D, no antibodies. Which blood components is the responsible for immune defense and fighting infection? Correct answer number is D, white blood cells. Next, what is the primary antibody present in the plasma of a person with blood type B? Correct answer number is A, anti-A पाया जाता है. Next questions. What is the purpose of the terms autologous donation in the blood banking? And correct answer number is A, donating blood for own self. Which blood type is considered the universal red cells donor in emergency situation? And correct answer number is B, O negative. Next questions. What is the maximum storage time for packed red blood cell in a blood bank refrigerator? Correct answer number is B, 21 days. Next questions. In blood banking, what does the terms apheresis refer to? Correct answer number is A, separation of blood components using centrifugation. Next questions. Which anticoagulant is commonly used in blood collection tube for routine blood test? Correct answer number is B, EDTA. What is the primary function of the Rh factor in blood tapping? And correct answer number D, predicting Rh compatibility drug pregnancy. During pregnancy. Next questions. Which blood components is responsible for maintaining blood pressure and electrolytes balance? Correct answer number is D, albumin. In the direct cum test, what does a positive result indicates? Correct answer number is a presence of antibodies on red blood cells. What is the purpose of a tourniquet during the blood donation process? Correct answer number B, to identify veins for needle insertion. Which blood type is considered the universal plasma donor in the ABO system? Correct answer AB, positive. Next, what is the primary function of the Rh factor in the blood? Correct answer oxygen transport. Next, in the ABO blood group system, which blood type can be person with blood type O reactive in a transfusion? Correct answer number is person with blood type O reactive in a transfusion. तो फ्रेंड्स इसका करेक्ट आंसर आप मेरे को नीचे कमेंट जरूर करेंगे. नेक्स्ट क्वेश्चन. व्हाट इज द टर्म फॉर अ कंडीशन वेयर द recipient antibodies attack and destroy transfused red blood cells? Correct answer number is A. Hemolysis. Next, which blood components responsible for maintaining blood pH and electrolytes balance? Correct answer number is D. Buffer. Next, what is the primary screening test used to determine blood type? Correct answer C. Blood typing. Which blood type is considered the universal donor for the plasma in the ABO system? Correct answer number is AB positive. In blood transfusion, what does the terms eradicated blood refers to? Correct answer number is D. Blood exposed to ionizing radiation to prevent graft versus host disease. Next, which blood type is the least common in the ABO system worldwide? Correct answer AB positive. What is the primary storage temperature for fresh frozen plasma in blood bank? Correct answer -20 degrees centigrade Celsius. Which type blood is considered the universal donor for the whole blood in the ABO system? O negative. What is the purpose of a blood bank quality control program? Correct answer is C. To maintain the accuracy of test result. Which blood components is responsible for transporting hormone and nutrients throughout the body? Correct answer number is C. Plasma. Next, what is the primary screening test for infectious disease in donated blood? Correct answer is D. Nucleic acid testing. What is the purpose of an antiglobulin Coombs test in blood banking? Correct answer number is A. To detect antibodies on red blood cells. Which blood components is play a crucial role in maintaining blood pressure and volume? Correct answer is D. Albumin. What is the primary function of the RHOGM Rogam injection during pregnancy? Correct answer number is A. To prevent RH incompatibility. In the ABO system, which blood type has both A and B maintaining on the red blood cell? Correct answer number is A. AB positive. Next questions. What is the terms for a blood clot that form and remains in a blood vessels? Correct answer number is B. Thrombus. नेक्स्ट सेकेंड पार्ट है फ्रेंड्स, जो सिकल सेल से रिलेटेड क्वेश्चन है. व्हाट इज द प्राइमरी कॉज ऑफ सिकल सेल डिजीज? तो ये होता है जेनेटिक म्यूटेशन के कारण होता है. सेकेंड क्वेश्चन, इन सेल सिकल सेल डिजीज द म्यूटेशन अफेक्ट द प्रोडक्शन ऑफ विच प्रोटीन इज रेड ब्लड सेल? करेक्ट आंसर नंबर इज hemoglobin. Yes. What is the typical shape of red blood cell in individual sickle cell disease? Crescent of या फिर सिकल सेल होता है। विच पॉपुलेशन इज द मोस्ट कॉमन अफेक्टेड बाय सिकल सेल डिजीज? करेक्ट आंसर अफ्रीकन। What is the major clinical manifestation of sickle cell disease? Correct answer is B. Joint pain. Which organ is the particularly vulnerable to damage in individual with sickle cell disease? Spleen. What trigger the sickling of red blood cell in sickle cell disease? Correct answer low oxygen level. Which of the following condition can result from the blockage of blood vessels by sickled cell in sickle cell disease? Answer number A, stroke. What is the recommended treatment for managing pain crisis in individuals with sickle cell disease? Correct answer number is C, pain medicine. How is sickle cell disease inherited? Correct answer number B, autosomal recessive. What is the term used to describe the heterozygous condition where an individual carries one hormone, normal hemoglobin gene and one sickle hemoglobin gene? Correct answer number is A, sickle cell trait. Which type of hemoglobin is the predominant in individual with sickle cell disease during a crisis? Correct answer number is D, hemoglobin. Yes. What is the primary role of hydroxyurea in the management of sickle cell disease? Correct answer reducing the frequency of painful crisis. पेनफुल क्राइसिस को रिड्यूस करता है, उसके लिए हाइड्रोक्सी यूरिया का इस्तेमाल किया जाता है। Which of the following is a potential complication of sickle cell disease related to the breakdown of red blood cell? Correct answer hyperbilirubinemia. What is the gold standard diagnosis test for confirming sickle cell disease? Hemoglobin electrophoresis. Which organ is the primarily responsible for the production of hemoglobin in the human body? C, bone marrow. In addition to pain management, what other therapeutic approach is commonly used for preventing complication in sickle cell disease? Correct answer number is C, stem cell transplant. Next, what preventive measure is recommended for newborn identified with sickle cell disease through newborn screening? Correct answer pneumococcal vaccination. Next, which blood component is affected by the abnormal hemoglobin in sickle cell disease leading to its characteristic shape? Correct answer number is B, red blood cell. Next, which of the following is symptom is not commonly associated with the sickle cell crisis? Correct answer migraine headache. What is the term for the condition where the spleen is the damaged and become non-functional in individual with sickle cell disease? Correct answer asplenia. What is the terms for the condition where is the spleen damaged or become non-functional in individual with sickle cell disease? And correct answer asplenia. Next, what is the primary goal of hematopoietic stem cell transplantation in sickle cell disease? Correct answer number is D. Prevent, sorry. Correct answer is B. Cure the disease. Which blood type is most commonly associated with sickle cell disease? सिकल सेल डिजीज जो ए पॉजिटिव होते हैं उनमें सबसे अधिक पाया जाता है. व्हाट इज द टर्म फॉर द कंडीशन वेयर इज अ पर्सन विथ सिकल सेल डिजीज इनहेरिट्स one sickle cell gene and one gene for hemoglobin C? Correct answer number is hemoglobin SC disease, sickle cell disease. What is the primary mechanism by which hydroxyurea exerts its therapeutic effects in sickle cell disease? Correct answer number is C, induced fetal hemoglobin production. What is the primary function of sickle cell screening program? Correct answer number is A, identify carriers of the sickle cell trait. Which of the following organ is the particularly susceptible to infection in individual with sickle cell disease due to impaired immune function? Correct answer number is A, lungs. What is terms for the acute chest syndrome, a serious complication of sickle cell disease characterized by chest pain and difficulty breathing? Correct answer, sickle cell crisis. What is the primary reason for the increased risk in infection in individual with sickle cell disease? Correct answer number is A, impaired immune system response. Which of the following complication is associated with the long-term use in hydroxyurea in sickle cell disease treatment? Correct answer number is D, bone marrow suppression. नेक्स्ट पार्ट है फ्रेंड्स मलेरिया से रिलेटेड 40 क्वेश्चंस है. चलिए मलेरिया से रिलेटेड 40 क्वेश्चंस देख लेते हैं. व्हाट इज द प्राइमरी कॉज ऑफ मलेरिया? मलेरिया के प्राइमरी कॉज कौन कौन से हैं? बैक्टीरिया, पैरासाइट्स, वायरस, फंगी. तो प्राइमरी कारक जो होते हैं वह पैरासाइट्स होता है जो प्लाज्मोडियम के कारण होता है. Which species of Plasmodium is responsible for the most severe form of malaria in humans? Correct answer number is A, Plasmodium falciparum. What is the true primary mode of transmission of malaria to humans? Correct answer, mosquito bite. Anopheles mosquito. In which part of the human body do malaria parasites undergo asexual production? Correct answer, red blood cells. Which type of malaria is known for its characteristic 48-hour fever cycle? Correct answer, P. malaria. Next, which of the following anti-malarial drug is derived from the bark of the cinchona tree? Correct answer number is A. C. Quinine. Next, what is the characteristic feature of Plasmodium vivax infection regarding replaces? Correct answer number is C. Multiple replace. Next, which stage of the malaria parasite's life cycle is responsible for human to mosquito transmission? Correct answer, gametocide. What is the recommended preventive measure for individual traveling to malaria endemic area? Correct answer number is B. What is the commonly name for the mosquito species most responsible for transmitting malaria in Africa? Correct answer number is A. Anopheles gambiae. Next questions. Which of the following is a common symptom of malaria? Correct answer number is A. Joint pain. What is the recommended first line treatment for uncompleted Plasmodium falciparum malaria? Is the many region where resistance is low. Correct answer number is ACT. Next, in which stage of the malaria life cycle do symptoms typically occur in the human host? Correct answer, trophozoite. Which population group is the particularly vulnerable to severe malaria, including cerebral malaria? Correct answer number is B. Children under 5 years old. Which Plasmodium species can cause replaces year after the initiation infection? Correct answer number is C. Plasmodium ovale. Next questions. Which is the terms for the severe from the malaria that can lead to seizures, coma and death? Correct answer number is C. Severe malaria. What is the primary vector control method for preventing malaria transmission? Correct answer, insecticides treated wet nets, जिसको LLIN भी कहते हैं, लॉन्ग लास्टिंग इंसेक्टिसाइड नेट. What is the name of the class of drug that include anterminin derives widely used in the treatment of malaria? Correct answer number is C. What is the primary role of the Anopheles mosquito in the malaria life cycle? Correct answer number is A. Transmitting the malaria parasite to human. What is the terms for the dormant form of the malaria parasites that can persist in the liver for an extended period before causing a replace? Correct answer, hypnozoite. Which contents bears the highest burden of malaria cases globally? Correct answer number is C. Africa. Next, which of the following is not a common symptom of severe malaria? Correct answer, wet gan. What is the recommended prophylactic drugs for travelers to malaria endemic area? Correct answer is doxycycline. Next, which of the following anti-malarial drug is known for causing vivid dreams or nightmares as a side effect? Correct answer, mefloquine. नेक्स्ट पार्ट है फ्रेंड्स बैक्टीरियल डिजीज. 50 एमसीक्यूज चलिए देखते हैं. विच बैक्टीरियम इज रिस्पॉन्सिबल फॉर कॉजिंग ट्यूबरक्लोसिस इन ह्यूमन? करेक्ट आंसर नंबर इज बी. माइकोबैक्टीरियम ट्यूबरक्लोसिस. What is the primary mode of transmission for Listeria coli, E. coli infection? Correct answer number is B. Contaminated food and water. Next questions: which bacterial pathogen is responsible for causing Lyme disease? Correct answer: Borrelia burgdorferi. What is the primary symptom of infection with Helicobacter pylori? Correct answer: abdominal pain. Which bacterial species is the commonly associated with a urinary tract infection? UTIs. Correct answer: B. Listeria coli. What bacterial genus include species that cause food poisoning such as Salmonella and E. coli? Correct answer number is D. Salmonella. Which bacterium is responsible for causing dental caries, tooth decay? So correct answer: Streptococcus mutans. What bacterial pathogen is associated with the development of peptic ulcer in the stomach? Correct answer: Helicobacter pylori. Which bacterial disease is transmitted through the bite of infected flies and the can causes severe pneumonia and septicemia? Correct answer number is B. Plague. Next, the what bacterial genus include species that can cause both strep throat and necrotizing fasciitis? Correct answer number is A. Streptococcus. Next, which bacterium is associated with the formation of pseudomembrane in throat that respiratory tract leading to a condition known as diphtheria? Corynebacterium diphtheria. Correct answer number is B. What is the causative agent of urinary tract infection that can scan to kidney causing pyelonephritis? Correct answer number is A. Listeria coli. Which bacterial pathogen is responsible for causing syphilis, a sexually transmitted infection? Treponema pallidum इसका correct answer है friends. Which bacterial infection is characterized by the presence of rice water stool and is associated with contaminated water and poor sanitation? Correct answer number is A. Cholera. What bacterial species is the commonly associated with causing respiratory tract infection, particularly in children, and it a common cause of otitis media? Correct answer: Moracella catarrhalis. Next questions: what bacterium is responsible for causing melioidosis, a potentially severe disease endemic in Southeast Asia and northern Australia. Correct answer is Burkholderia pseudomeli. Next, which bacterium is associated with causing leprosy, a chronic infectious disease that primarily affected the skin, peripheral nerves, and mucous membranes of the respiratory tract? Correct answer number is A. Microbacterium leprae. नेक्स्ट क्वेश्चन है फ्रेंड्स, वायरोलॉजी से 80 क्वेश्चन है। नेक्स्ट क्वेश्चन देख लेते हैं, व्हाट इज द जेनेटिक मटेरियल ऑफ अ वायरस? तो वायरस का जेनेटिक मटेरियल क्या है? तो बोथ डीएनए एंड आरएनए होता है। नेक्स्ट, विच एंजाइम इज रिस्पॉन्सिबल फॉर रिफ्लेक्टिंग वायरल आरएनए टू into DNA in retrovirus? Correct answer, reverse transcriptase. Next, what is the outer portion coat of a virus called? Option number C, caspid. Next, in which host cell organelle does the application of many viruses take place? Correct answer number is A, nucleus. Next, what is the primary function of the viral envelope? Correct answer, facilitating viral entry into host cell. Which type of viruses utilized reserve transcriptase of convert its RNA genome into DNA inside the host cell? Correct answer number is A, retrovirus. And जो HIV भी होता है फ्रेंड्स, वो भी रेट्रोवायरस समूह का होता है। What is the term for a virus that infect bacteria? बैक्टीरियोफेज कहलाता है। Which viral family does the human immunodeficiency virus? ये होता है रेट्रोवायरिडी। What is the name of the protein code surrounding the nucleic acid of a virus? Correct answer, capsid. What is the process by which a virus enters a host cell and releases its genetic material? Correct answer number is D, entry or present penetration. Penetration. What is the term for a virus that contains both RNA and DNA in its genome? Correct answer number is A, retrovirus. Which viral family does the influenza virus belong to? Option number B, Orthomyxoviridae. What is the primary target of human immunodeficiency virus in the human body? Correct answer is T cells. What is the primary mode of transmission for the Zika virus? Correct answer is mosquito bite. What is the name of the phenomenon where a virus integrates its genetic material into the host cell genome and remains latent? Correct answer, lysogeny. Which virus is responsible for causing the majority of cervical cancer cases? ये होता है ह्यूमन पेपिलोमा वायरस. What is the name of the protein spikes on the surface of the influenza virus that determine its subtype? Correct answer number is B. Hemagglutinin. Which virus is responsible for causing hand, foot, and mouth disease in children? Correct answer, Coxsackie virus. What is the primary target of the measles virus in the human body? Correct answer, respiratory epithelial cell. Which virus is responsible for causing infectious hepatitis and commonly transmitted through contaminated food and water? Correct answer is hepatitis A. हेपेटाइटिस ए और हेपेटाइटिस ई जो होता है दोनों कंटामिनेटेड फूड एंड वाटर से ट्रांसमिटेड होते हैं, फैलते हैं. Which virus is responsible for causing the majority of case of common cold? Correct answer, rhinovirus. What is the name of the viral enzyme responsible for the synthesizing DNA from an RNA template during retrovirus replication? Correct answer, reverse transcriptase. Next question, which virus is responsible for causing severe acute respiratory syndrome? SARS के लिए जो होता है कोरोना वायरस. Next, which virus is associated with causing Kaposi's sarcoma, a cancer often seen in immunocompromised individuals such as those with HIV/AIDS? Correct answer number is B. Human herpes virus 8, HHV8. What is the primary mode of transmission for the hepatitis B viruses? Correct answer number is answer number D. Contact with infected blood and body fluids. Next questions, which viruses is associated with causing hand, foot and mouth disease, particularly in young children? Correct answer number is A. Which viral family include the viruses causing mumps and parainfluenza? Correct answer, Paramyxoviridae. Correct answer number is C. What is the primary target of the poliovirus in the human body? Correct answer, nervous system cell. What is the primary mode of transmission for the mumps virus? Correct answer number is D. Respiratory secretion. Which viral family includes the virus causing SARS-CoV-2 COVID-19? Correct answer Coronaviridae. What is the primary mode of transmission for the West Nile virus? And correct answer mosquito bite. Which viral family includes the viruses causing the common cold and bronchiolitis bronchiolitis in infant? Correct answer adenovirus. Which virus is the responsible for causing German measles or rubella? Correct answer rubivirus. What is the primary target of the measles virus in the human body? Correct answer number is respiratory epithelial cell. What is the name of the viral enzyme responsible for the copying RNA into DNA during reverse transcription in retrovirus? And correct answer is reverse transcriptase. नेक्स्ट क्वेश्चन है फ्रेंड्स इम्यूनोलॉजी से रिलेटेड क्वेश्चन है जो हमारा 100 क्वेश्चन आएगा इम्यूनोलॉजी से रिलेटेड। तो चलिए स्टार्ट करते हैं अब से। इसका पहला क्वेश्चन, व्हाट इज द प्राइमरी फंक्शन ऑफ एंटीबॉडीज इन द इम्यून सिस्टम? एंड करेक्ट आंसर नंबर इज डी, बाइंडिंग द टू एंटीजन एंड न्यूट्रलाइजेशन। Which cell are responsible for presenting antigen to T cell in the immune system? Correct answer macrophage. Next questions. What is the primary role of T cell in the immune response? Correct answer cell mediated immunity. Correct answer number is C. Next, which immunoglobulins is involved in allergic reaction and is found on the surface of the mast cell and basophils? Correct answer IgE, immunoglobulins epsilon. What is the role of the thymus in the immune system? Correct answer number is B, maturation of T cell. Which cell are responsible for the producing antibodies in the immune system? Correct answer number is B, B cell. What is the process by the immune cells engulf and digest foreign particle or cells? Correct answer phagocytosis. What is the primary function of helper T cell in the immune system? Correct answer number is C, coordinating immune response. Which molecule is responsible for antigen recognition by T cell? Correct answer number is B, major histocompatibility complex NHC. What is the role of dendritic cell in the immune system? Correct answer number is D, antigen presentation. Which immunoglobulins is the most abundant in the blood and it is the first to appear during the immune response? Correct answer number is IgM. What is the function of memory cell in the immune system? Correct answer number is B, long-term protection against specific pathogens. Which type of immunity is the confirmed by the transferred to sensitized T cell from a donor to a recipient. Correct answer number is the B, cell mediated immunity. Which cell are responsible for the releasing histamine and mediating immediate hypersensitivity reaction? Correct answer number is C, mast cell. Next, what is the primary function of a natural killer NK cell in the immune system? Correct answer, killing infected and cancerous cells. Which type of the responsible for producing cytokines that modulate the activity of other immune cells? Correct answer number is T cell. What is the primary function of the complement system in the immune response? Cytolysis. Which cell type play a crucial role in the surveillance for and destruction of virus infected cell in a non-specific manner? Natural killer cell. Which immunoglobulins is the primarily found in mucosal secretions such as saliva and tears? Immunoglobulins alpha IgA. What is the function of the major histocompatibility complex in the immune system? Correct answer number B, antigen presentation. Next, which type of T cell is the responsible for suppressing immune response to prevent autoimmunity? Correct answer number is D, regulatory T cell. What is the function of the thymus in the context of the T cell developments? And correct answer, mutation of T cell. What is the primary function of the antibodies in the opsonization process? Correct answer, facilitation of phagocytosis. What is the role of memory B cell in the immune system? Correct answer, long-term protection against specific pathogens. What is the function of the spleen in the immune system? Filtering and monitoring blood for pathogens. Which cells are responsible for producing antibodies with high specific for a particular antigens? Correct answer number is a plasma cell. Which class of antibodies can cross the placenta and provide passive immunity to the fetus? Correct answer, IgG, immunoglobulins gamma. What is the primary function of complement proteins in the immune system? Correct answer number is D, cytolysis. Which cell type play a central role in the rejection of transplanted organs and tissues? Correct answer number D, cytotoxic cell. Next, what is the term for the ability of the immune system to distinguish self from non-self? Correct answer number is A, immune tolerance. Next, what is the main function of complement cascade in the immune response? Correct answer, cytolysis of pathogens. Next, which cells are responsible for the production of antibodies with diverse specificities during an immune response? Correct answer number is a plasma cell. What is the term for the ability of an antigen to stimulate an immune response? Correct answer immunogenicity. What is the main function of IgE antibodies in the immune response? Correct answer number is D. Mediation of allergic reaction. Which cell type is the primarily responsible for the presenting antigens to CD4 plus helper T cells during the immune response? Correct answer number is a macrophages. What is the term for the phenomenon where antibodies and antigens insoluble complex that precipitate out of solution? And correct answer number B, agglutination. Which immunoglobulins class is involved in the defense against parasitic infection and allergic response? Answer IgE. Next, what is the primary function to of toll-like receptor in the innate immunity response? Correct answer number is D. Recognition of pathogen associated molecular patterns. What is the term for the process by which antibodies? Correct answer neutralization. Which immunoglobulins class is found on the surface of mast cell and basophils and it is involved in allergic reaction? Correct answer IgE. Which cell type is the responsible for the production of antibodies with high specificity for a particular antigen during the secondary immune response? Correct आंसर मेमोरी बी सेल्स। तो फ्रेंड्स हमारे वायरोलॉजी के 100 क्वेश्चंस कंप्लीट हो चुके हैं। अब साइटोलॉजी के 80 क्वेश्चंस हम लेके आए हैं। चलिए अब साइटोलॉजी के 80 क्वेश्चंस देखते हैं। तो फ्रेंड्स अभी समथिंग हमारा 400 क्वेश्चंस रेडी हो चुके हैं, अभी 600 और बाकी है। तो चलिए फ्रेंड्स आगे बढ़ते हैं। उम्मीद करता हूँ ये वीडियो आपको पसंद आ रहे होंगे। तो दोस्तों को भी शेयर करना है। इसके पीडीएफ चाहिए तो मैंने ऑलरेडी एक वीडियो बना के रखा है, वहां से आप पीडीएफ डाउनलोड कर सकते हैं, वहां इसका लिंक दिया हुआ है। What is the primary function of the endoplasmic reticulum in a cell? Correct answer protein synthesis. Second question, which cellular organelle is responsible for the breakdown of cellular waste and damaged organelles? Correct answer lysosome. What is the main function of the nucleus in a eukaryotic cell? Correct answer number is C, storage of genetic information. Next, which structure is responsible for the production of ribosomal RNA in a cell? Correct answer is A, nucleus. In which phase of the cell cycle does DNA replication occurs? Correct answer number is B, S-shape. Next, what is the primary function of the mitochondria in a cell? Correct answer number is B, energy production. Which cellular structure is responsible for maintaining cell shape, providing structural support and facilitating cell movement? Correct answer microtubules. Where is the role of the Golgi apparatus in a eukaryotic cell? Correct answer, modification and packaging of proteins. Which cellular structure is involved in the separation of chromosomes during cell division? Correct answer number is A, centriole. What is the primary function of the smooth endoplasmic reticulum in a cell? Correct answer, lipid synthesis and detoxification. Which cellular organelle is responsible for generating energy through cellular respiration? Correct answer, mitochondria. Which is the main function of peroxisomes in a eukaryotic cell? Correct answer number is C, detoxification and breakdown of fatty acid. In which phase of the cell cycle does cell division mitosis occur? M phase. Next, what is the primary function of the cystole in a eukaryotic cell? Correct answer, protein synthesis. Next, in which organelle does cellular respiration occur leading to the production of ATP? Correct answer, mitochondria. Which cellular structure is involved in the formation of spindle fibers during cell division? Correct answer number is A, centriole. Next, what is the role of the nuclear membrane in a eukaryotic cell? Correct answer number is D, control of substance entering the and leaving the nucleus. Which organelle is responsible for the synthesis of phospholipids and steroids? Correct answer, endoplasmic reticulum. What is the function of microtubules in the cytoskeleton of a cell? Correct answer, a structural support. What is the terms of terms for the process by which cell engulf small particular or fluids by forming vesicles? Correct आंसर पिनोसाइटोसिस। तो फ्रेंड्स ये हमारा क्वेश्चंस रहा। अब चलिए पेप स्मीयर से रिलेटेड 20 क्वेश्चंस देख लेते हैं। व्हाट इज द प्राइमरी पर्पस ऑफ अ पेप स्मीयर? तो पेप स्मीयर डिटेक्शन ऑफ सर्वाइकल कैंसर एंड प्री कैंसरियस चेंजेस, पेप्रिकोला स्मीयर के नाम से भी जाना जाता है। What is the age of recommended for women to start getting regular pap smear as part of cervical cancer screening? Correct answer 25, but 30 years में अब इसको किया जाता है सर्वाइकल कैंसर के लिए, पर 5 years में टेस्ट कराना चाहिए। What is the recommended frequency for pap smear for women with normal result? Correct answer एवरी 3 years, किंतु अब ये एवरी 5 years हो चुका है फ्रेंड्स। व्हाट डज द पेप टेस्ट इन्वॉल्व? ब्लड टेस्ट, यूरिन टेस्ट, कलेक्शन ऑफ द सेल फ्रॉम द सर्विक्स फॉर एग्जामिनेशन एंड इमेजिंग स्टडी ऑफ द यूट्रस। तो जो सर्विक्स होता है इसमें सेल को कलेक्शन किया जाता है और उसी का एग्जामिनेशन किया जाता है। Which virus is a major cause of cervical cancer and is often detected in pap smear result? Correct answer number is B, human papilloma virus. अब देख लेते हैं फ्रेंड्स सर्वाइकल कैंसर से रिलेटेड। व्हाट इज द प्राइमरी कॉज ऑफ सर्वाइकल कैंसर? तो इसका होता है ह्यूमन पेपिलोमा वायरस। Which type of HPV is the most strongly associated with the development of cervical cancer? ये होता है high risk HPV types, especially 16 and 18. What is the role of the HPV vaccine in cervical cancer prevention? Correct answer, prevention of high risk HPV types including 16 and 18. Which of the following is a non-risk factor for the development of cervical cancer? Correct answer, multiple sexual partners. What is the purpose of a colposcopy in the evaluation of cervical abnormalities? Correct answer, visualization and biopsy of the cervix. What is the most common histological type of cervical cancer? Correct answer, squamous cell carcinoma. Next, what is the recommended age for initiating cervical cancer screening with pap smear is most guidelines? Correct answer, 25 years. What is the primary treatment for early stage cervical cancer? Correct answer is B, hysterectomy. Which of the following is a symptom commonly associated with advanced cervical cancer? Correct answer number is B. Vaginal bleeding after intercourse. What is the role of a cone biopsy in the diagnosis and treatment of cervical abnormalities? Correct answer: removal of a cone-shaped piece of the cervix for examination. What is the primary purpose of adjuvant therapy in the treatment of cervical cancer? Correct answer number is B. To prevent the recurrence of cancer. Which modality is commonly used for the imaging evolution of cervical cancer spread to distant organs? Correct answer number is D. Positron emission tomography scan. What is the role of pelvic exenteration in the management of locally advanced cervical cancer? Correct answer number is C. To remove the uterus, cervix, and surrounding structure. What is the main goal of cervical cancer? Survivorship care. Correct answer: to address the physical and emotional need of survivors. नेक्स्ट है फ्रेंड्स बेस्ट कैंसर से रिलेटेड एमसीक्यूज है, 20 क्वेश्चंस आएंगे इसमें भी. व्हाट इज द प्राइमरी पर्पस ऑफ अ मैमोग्राम इन द ब्रेस्ट कैंसर स्क्रीनिंग? अर्ली डिटेक्शन ऑफ ब्रेस्ट कैंसर. It was the generally recommended for women to start regular mammogram screening for breast cancer. Age is 40 years. अब आ गया फ्रेंड्स हिस्टोपैथोलॉजी से रिलेटेड 100 एमसीक्यूज है. तो चलिए अब हिस्टोपैथोलॉजी से स्टार्ट कर लेते हैं. तो फ्रेंड्स इस तरीके से मैंने पूरे 100 क्वेश्चंस आपको आज बताने वाला हूँ वीडियो में. अगर वीडियो लंबा होता है तो आप इसको डाउनलोड कर सकते हैं. मेरे नीचे पीडीएफ में बताया हूँ कि कैसे पीडीएफ आप डाउनलोड कर सकते हैं. एक लास्ट वीडियो है जिसमें आप देख सकते हैं मैंने 3000 के क्वेश्चंस के 2001 से लेकर 3000 तक के जो 1000 क्वेश्चंस है उसकी पीडीएफ कहाँ से मिलेगा, क्या पासवर्ड है, वो आप सबको पता ही है. चलिए अब नेक्स्ट देखते हैं. व्हाट इज द प्राइमरी पर्पस ऑफ हिस्टोपैथोलॉजी? करेक्ट आंसर: एग्जामिनेशन ऑफ टिश्यू फॉर स्ट्रक्चरल एबनॉर्मलिटीज एंड डिजीज. नेक्स्ट, व्हाट डज इम्यूनोहिस्टोकेमिस्ट्री इन्वॉल्व in histopathology? Correct answer: standing for specific protein using antibodies. Next, histopathology. What does the terms biopsy refer to? Correct answer number is B. Collection of tissue sample for microscopic examination. What is the role of pathologist in histopathology? Correct answer number is B. Analysis and interruption of tissue specimen. Next, which staining method is the commonly used to highlighting collagen fiber in histopathological slides? Correct answer number is B. Mason's trichome stain. Next, what is the terms for the study of cell and tissue under the microscope to diagnose disease? Correct answer number is B. Histology. Next, what does the term histopathological grading refer to? Correct answer, evaluating to the degree of differentiation of tumor cell. What is the purpose of using special stain in histopathology? Correct answer number is B. To differentiate between benign and malignant tumors. What is the term for the microscopic examination of cells that are scraped from a tissue surface for diagnostic purpose? Correct answer number is B. Cytology. Next, which of the following stain is commonly used for highlighting acidic components like mucin in histopathology? Correct answer is A. Periodic acid ships पैस stain, जिसको कहते हैं शॉर्ट में. What is the purpose of using immunofluorescence in histopathology? Correct answer number is A. To visualize structure under ultraviolet light, जिसको immunofluorescence microscopic कहते हैं. In histopathology, what does the terms in situ indicates when describing a lesion or tumor? Correct answer, limited to the original site without invasion. What is the purpose of a fine needle aspiration in histopathology? Correct answer, aspiration of cell for cytological evaluation. What does the terms tumor margin refer to in histopathology? Correct answer number is B. What is the primary advantage of immunohistochemistry in comparison of routine histological staining? What is the primary purpose of a special stain like Mason trichome in histopathology? Correct answer, highlighting collagen fibers. Which staining method is commonly used to visualize microorganisms such as bacteria and fungi in tissue section? Correct answer, gram stain. In histopathology, what does the terms metaplasia refer? Correct answer number is D. Replacement of one mature cell type with another. What is the purpose of using the tunnel assay in histopathology? Correct answer, detections of apoptosis in tissue section. Which of the following is a common application of fluorescence in situ hybridization in histopathology? Answer, detections of specific DNA sequence or gene abnormalities. Which of the following stain is commonly used to visualize amyloid deposits in tissue sections? Correct answer, Congo red stain. What is the role of electron microscopy in histopathology? Correct answer number A. Visualization of cellular structures at the molecular level. What does the terms granuloma refer to in histopathology? Correct answer number is A. Option number C. A collection of immune cells. In histopathology, what does the terms dysplasia indicate? Answer: change in the size and shape of cell. What is the primary purpose of Gill-Nansen stain in histopathology? Correct answer: visualization of acid-fast bacteria like Microbacterium tuberculosis. What does the terms cryosectionize involve in histopathology? Answer: rapid freezing and sectioning of tissue for examination. What is the primary purpose of H&E stain in histopathology? Correct answer: visualization of cell nuclei. What is the significance of the Warthin steri stain in histopathology? Answer: reductions of Helicobacter pylori in gastric biopsy. In histopathology, what does the terms angiogenesis refer to? Answer: formation of new blood vessels. What is the primary purpose of a toluidine blue stain in histopathology? Correct answer number C. Visualization of mast cell and basophils. Which of the following is a common fixative used in histopathology to preserve tissue for examination? Correct answer number is C. Formaldehyde. What is the primary purpose of a Gomori methenamine silver stain is in histopathology? Correct answer C. Identification of fungal element. Next, in histopathology, what does the terms Langerhans cell refer to? Answer: immune cell in the skin and mucous membrane. Next, what is the significance of the John Silver stain in renal histopathology? Answer is B. Visualization of glomerular basement membrane. What does the terms mucinous carcinoma refer to in histopathology? Correct answer A. Subtype of breast cancer characterized by mucin. So option number B is correct. What is the purpose of periodic acid methenamine silver PAMS stain in histopathology? Answer is A. Identification of fungal element. Which staining technique is commonly used to visualize reticulin fiber in histopathological section? Correct answer number is C. Silver impregnation stain. What is the primary role of a pathologist in the analysis of histopathological specimen? Correct answer number C. Analysis and interpretation of tissue specimen. Which of the following stain is commonly used for highlighting eosinophils in tissue section? Correct answer number B. Wright's stain. What is the significance of the Mallory trichrome stain in histopathology? Correct answer number C. Highlighting collagen fiber. In histopathology, what does the terms tumor budding refer to? Correct answer number B. Cluster of tumor cell at the tumor margin. What is the primary purpose of a right Giemsa stain in histopathology? Correct answer, staining for blood cells. In histopathology, what does the terms hyalinization refer to? Correct answer, degeneration and glassy appearance of tissue. What is the primary purpose of a Verhoeven Jisson's stain in histopathology? Correct answer number B. Visualization of elastic fibers. Next, in histopathology, what does the terms myocarditis refer to? Option number C. Inflammation of the heart muscles. Next, what is the primary purpose of a papillocolor stain in histopathology? PEP. Correct answer, visualization of cell nuclei in cytological smear. In histopathology, what does the terms xanthoma refer to? Option number B. Accumulation of rapid laden macrophages. What is the primary purpose of a Gill-Nansen stain in histopathology? Correct answer, visualization of acid-fast bacteria. In histopathology, what does the terms osteoid refer to? Correct answer, hard bony tissue. Next, what is the purpose of a Fontana-Mason stain in histopathology? Correct answer, identification of melanin. Next, in histopathology, what does the term granulation tissue refer to? Correct answer, newly formed tissue during wound healing. What is the primary purpose of a silver stain such as the Steiner stain in histopathology? Correct answer number B, reduction of Helicobacter pylori. In histopathology, what does the terms hemosiderin refer to? Correct answer, iron containing pigment. What is the primary purpose of a Giemsa stain in histopathology? Correct answer, A, identification of fungi. In histopathology, what does the terms cryptococcosis refer to? Fungal infection. What is the primary purpose of Luxol fast blue stain in histopathology? Correct answer number B, visualization of nerve fibers. In histopathology, what does the terms syncytium refer to? Correct answer, fused cell in with shared cytoplasm. What is the significance of right Giemsa stain in hematopathology? Correct answer number is B, visualization of blood cells in peripheral smear. In histopathology, what does the terms xanthelasma refer to? Correct answer number is A, accumulation of lipid-laden macrophages in skin. What is the primary purpose of Fontana Mason silver stain in histopathology? Correct answer, detections of melanin in tissue. In histopathology, what does the terms carcinoma in situ (CIS) refer to? Correct answer number is B, cancer confined to the epithelium without invasion. What is the primary purpose of Jill Nelson stain in histopathology? Visualization of acid fast bacteria like Microbacterium tuberculosis. ये second time आ चुका friends questions. Next, in histopathology, what does the terms acrocordon refer to? Correct answer, skin tag or soft fibroma. Next, what is the primary purpose of a right Giemsa stain in histopathology? Correct answer number is B, visualization of blood cells including red and white cell. In histopathology, what does the terms Langerhans cells histocytosis refer to? Correct answer, accumulation of abnormal Langerhans cell. What is the primary purpose of Wartin Steri silver stain? Correct answer number is C. सॉरी फ्रेंड्स, मेरे को सर्दी पकड़ा हुआ है. What is the primary purpose of a Gomori trichrome stain in histopathology? Correct answer number is C. Identification of collagen fibers. In histopathology, what does the terms leiomyoma refer to? Correct answer number is A. What is the primary purpose of methenamine silver stain in histopathology? Correct answer. Detections of fungal elements. In histopathology, what does the terms anaplasia refer to? Correct answer number B. Loss of differentiation in cells associated with malignancy. What is the primary purpose of methylene green pyrimidine stain in histopathology? Correct answer number is D. Standing for nucleic acid in cells. Next, in histopathology, what does the terms ESOP bodies refer to? Correct answer number C. Characteristic of pneumotic fever in the heart tissue. What is the primary purpose of mucicarmine stain in histopathology? Correct answer number D. Stain in mucin in cells. In histopathology, what does the terms Kaposi's sarcoma refer to? Correct answer number is C. Malignancy associated with human herpes virus 8. What is the primary purpose of a crystal violet stain in histopathology? Correct answer number is A. Visualization of nervous fibers. In histopathology, what does the terms fibroadenoma refer to? Correct answer number is A. Benign tumor of the breast. What is the primary purpose of reticulin stain in histopathology? Option number C is correct. Identification of reticular fibers in tissues. Correct answer is C. In histopathology, what does the terms giant cell refer to? And correct answer number is A. Large cell with abundant cytoplasma. Next, what is the primary purpose of a right stain in histopathology? Correct answer number B. Visualization of blood cell, including red and white blood cells. In histopathology, what does the terms angiosarcoma and is correct answer malignancy of blood vessels. What is the primary purpose of a paste digest stain in histopathology? Correct answer number C. Identification of glycogen in tissue. In histopathology, what does the terms osteosarcoma refer to? Correct answer number is A. Malignancy of the bone. What is the primary purpose of a toluidine blue stain in histopathology? Correct answer number B. Visualization of nerve fibers and mast cell. In histopathology, what does the terms nephritis? Nephritis is referred to, correct answer, inflammation of the kidney. तो फ्रेंड्स ये हमारा क्वेश्चंस पूरा 100 हो चुका है हिस्टोपैथोलॉजी से रिलेटेड। अब देखेंगे जो क्वेश्चंस है वो एनाटॉमी एंड फिजियोलॉजी से 100 एमसीक्यूज है। अब स्टार्ट करते हैं एनाटॉमी के क्वेश्चंस। What is the primary function of the respiratory system? Correct answer number is B. Gas exchange. Next, which type of muscle is voluntary and under conscious control? Correct answer number is C. Skeletal muscles. Next, the heart is part of which system in the human body? Correct answer, cardiovascular system. What is the main function of kidney in urinary system? Correct answer number is C. Filtration and fixation of waste product. Next, which hormone is responsible for regulating blood sugar levels? Correct answer number is A. Insulin. Next, what is the role of digestive system in the body? Correct answer, nutrients absorptions. Next, which part of the brain is responsible for the coordinating muscles movement and maintaining balance? Correct answer, number B, cerebellum. What is the function of the endocrine system? Answer number C, secretion of hormones to regulate body function. Where does the process of digestion primarily occur in the human body? Correct answer number is B, small intestine. Next, which of the following is a function of the integumentary system? Correct answer number C, protein against pathogens and dehydration. Sorry, protection against pathogen and dehydration. What is the primary function of the respiratory diaphragm? Correct answer number B, facilitate breathing by contracting and relaxing. Which hormone is responsible for regulating the body's sleep wake cycle? सोना उठना कौन सा हार्मोन से रेगुलेट करता है? तो ये होता है मेलाटोनिन। What is the purpose of the lymphatic system in the body? Correct answer number is B. Immune defense and fluid balance. The central nervous system consists of, correct answer number is A. Brain and spinal cord. Which organ is responsible for detoxifying harmful substance in blood? Correct answer number is B. Liver. What is the function of red blood cells erythrocyte in the circulatory system? Correct answer number is A. Carry oxygen to tissue. Which part of the brain is responsible for regulating body temperature and hunger? Correct answer hypothalamus. What is the primary function of the large intestine? Correct answer water absorption and formation of feces. Next, which hormones is responsible for the fight or fight response in stressful situation? Correct answer number is C. एड्रीनलिन, जिसको एपिनेफ्रिन भी कहते हैं. नेक्स्ट, where are sweat glands primarily found in the skin? Correct answer is A. Dermis. Next questions. Which is the primary function of the spleen in the human body? Correct answer number is B. Filtration of blood and storage of platelets. Next questions. Which hormone is responsible for regulating calcium level in the blood? Correct answer parathyroid hormone. What is the purpose of the eustachian tube in the ear? Correct answer number is A. Equalize air pressure between the middle ear and the atmosphere. The trachea is commonly known as the wind pipe. विंड पाइप के नाम से ट्रेकिया जाना जाता है. What is the primary function of the adrenal glands? Correct answer number B. Production of the adrenal and cortisol.
कौन वाला आपको?
अरे वही 10,000 वाला को मैं साइकिल लेने गया था ना, उस समय वो बोल रहा था कि मैं लेवे करूंगा, वही था ना वो वाला गाड़ी।
उसको भेज दिया।
हाँ
यार
बिन्नी बिन्नी जी अरे ये भी अच्छा रिस्पेक्ट कर रहा था, बोले अच्छा रिस्पेक्ट है एक दूसरे जन के।
अच्छा रिस्पेक्ट कर रहे हो।
कर रहे हो
कर रहे हैं।
चल बेटा।
रिस्पेक्ट कर रहे हैं। बिन्नी ही भेजी है।
The structure that separates the thoracic cavity from the abdominal cavity is called the correct answer number is a diaphragm. What is the primary function of the pancreas in the digestive system? Correct answer number is B, regular of blood sugar level. Which of the following statements about red bone marrow is correct? Correct answer number is B. Red bone marrow produce red and white blood cell. Correct answer number is B. Next, what is the purpose of the vestibular system in inner ear? Correct answer number is B. Balance and spatial orientation. Which of the following is a function of the lymph node in the lymphatic system? Correct answer number B. Production of antibodies. The process of which an egg matures and is released from the ovary is called. Correct answer ovulation. What is the primary function of cornea in the eye? Correct answer number B. Reflect light to focus in on the retina. Which of the following bone is part of the appendicular skeleton? Correct answer number C. Humerus. What is the function of the alveoli in the respiratory system? Correct answer number C. Exchange the gas, oxygen and carbon dioxide with the blood stream. What is the function of the thyroid gland in the endocrine system? Correct answer number B, control of metabolic rate and energy production. The joint between two bones that allow movement in multiple directions is called A. Correct answer number B, ball and socket joint. Which part of the brain is responsible for regulating basic life functions such as heartbeat and breathing? Correct answer, medulla oblongata. The epiglottis prevent from the food from entering which structure during swallowing? Correct answer is A. Trachea, the windpipe. What is the function of the gallbladder in the digestive system? Correct answer number B, storage and concentration of bile. Which blood vessels carry deoxygenated blood back to the heart? Correct answer number is B, veins. The process of which cell engulf and digest foreign particular or damaged cell is called. Correct answer number is A, phagocytosis. Where does the process of digestion begin in the human digestive system? Correct answer number is C, mouth. What is the function of the semicircular canals in the inner ear? Correct answer number B, balance the spatial orientation. Next, which of the following is a function of the skeletal system? Correct answer, production of blood cell. What is the primary function of the iris in the eye? Correct answer number B, control the size of the pupil and regulate the amount of light entering the eye. Which of the following bones is part of the axial skeleton? And correct answer number C, sternum. What is the function of the cochlea in the inner ear? Correct answer number B, hearing and detection of sound waves. The joint between the atlas and axis vertebrae allow for, correct answer, rotation of the head. Next, what is the primary function of the thymus gland in the immune system? Correct answer, maturation of T lymphocytes. The terms hemostasis refer to, correct answer, maintenance of a constant internal environment. Which part of the respiratory system is responsible for exchanging gas with the bloodstream? Correct answer, alveoli. Which hormone is responsible for regulating water balance in the body? Correct answer, aldosterone. The joint between the skull and the first cervical vertebrae is known as the correct answer pivot joint. What is the role of the pineal glands in the endocrine system? Correct answer number B. Production of melatonin and regulation of sleep-wake cycle. The process by which blood vessels constrict constrict to reduce blood flow is called. Correct answer vasoconstriction. What is the primary function of the malleus, incus and stapes in the middle ear? Correct answer B. Amplify and transmit sound vibration to the inner ear. Which of the following structures is responsible for producing insulin in the pancreas? Correct answer beta cell. Which part of the eye is responsible for detecting color and fine detail in vision? Correct answer retina. What is the function of the vas deferens in the male reproductive system? Correct answer transport of sperm from the testes to the urethra. The primary function of white blood cells, leukocytes, is correct answer immune defense against pathogens. Which of the following is not a function of the urinary system? Correct answer प्रोडक्शन ऑफ इंसुलिन. ये कार्य जो होता है वो पेनक्रियास के द्वारा होता है. व्हाट इज द प्राइमरी फंक्शन ऑफ द एड्रिनल कॉर्टेक्स? प्रोडक्शन ऑफ एड्रेनालिन, रेगुलेशन ऑफ सुगर लेवल, ब्लड सुगर लेवल, सिंथेसाइज ऑफ कंट्रोल्स एंड एल्डोस्टेरोन एंड फिल्ट्रेशन ऑफ ब्लड. एंड करेक्ट आंसर है सिंथेसिस ऑफ कॉर्टिसोल एंड एल्डोस्टेरोन. Which of the following is a function of the parathyroid gland? Correct answer number C. Regulation of calcium level in the blood. Where does the process of sperm maturation occur in the male reproductive system? Correct answer epididymis. What is the primary function of the mucus produced by the respiratory system? Correct answer number is B. Protection and moistening of airway. The process by which the body converts food into energy is known as. Correct answer metabolism. Which blood vessels carry oxygenated blood from the lungs? Correct answer veins. जो वेन्स होते हैं वह लंग से हार्ट तक ऑक्सीजनेटेड ब्लड करते हैं, और इसके अलावा जितने वेन्स हैं जो बॉडी पार्ट से हार्ट तक लेके आते हैं वह डीऑक्सीजनेटेड ब्लड होता है। इसमें आप कंफ्यूजन नहीं होंगे। नेक्स्ट, द टर्म्स हिमोटोपोइसिस हेमेटोपोइसिस रेफर टू। करेक्ट आंसर, formation of blood cell. What is the function of the epiglottis during swallowing? Correct answer, prevent food from entering the trachea. Which of the following is a function of the lymphatic system? Correct answer, immune defense and fluid balance. What is primary function of the islet of Langerhans in the pancreas? Correct answer, synthesis of insulin. Which of the following structures is responsible for producing cerebrospinal fluid in the brain? Correct answer number is C, choroid plexus. The joint between the humerus and the ulna is an example of a, correct answer, hinge joint. What is the primary function of the gallbladder in the digestive system? Correct answer, answer number B, storage and concentration of bile. The process of converting glucose into energy in the presence of oxygen is called, correct answer, anaerobic respiration. Which of the following hormones is responsible for stimulating uterine contraction during childbirth? Correct answer, oxytocin. What is the function of the semilunar valve in the heart? Correct answer, direct blood to the pulmonary and systematic circulation. Which of the following is a function of the spleen in the lymphatic system? Correct answer is A, filtration of blood and storage of platelets. Next, the process of mitosis is involved in, correct answer, growth and repair of body tissues. What is the primary function of the vestibulocochlear nerve? Correct answer, hearing and balance. What is the primary function of the vas deferens in the male reproductive system? Correct answer, transport of sperm from the testic to the urethra. कपड़ा धो ली रजना। अच्छा। Next, what is the main function of the mucus produced by the digestive system? Correct answer is a protection of a stomach lining. तो फ्रेंड्स ये हमारा एनाटॉमी एंड फिजियोलॉजी के 100 क्वेश्चंस कंप्लीट होते हैं। अब बात करते हैं क्लिनिकल पैथोलॉजी। क्लिनिकल पैथोलॉजी से रिलेटेड अब 100 क्वेश्चंस लेके आएंगे। तो इस तरीके से फ्रेंड्स टोटल हमारा 1000 क्वेश्चंस का टारगेट पूरा होगा। लास्ट में मैं इसका पीडीएफ का लिंक भी आपको दे दूंगा नीचे डिस्क्रिप्शन पे, और उसके साथ साथ उसका पासवर्ड भी, उसमें पासवर्ड लगा हुआ है। और चलिए अब आगे बढ़ते हैं। व्हाट इज द प्राइमरी पर्पस of a complete blood count? तो इसका जो करेक्ट आंसर है वो एग्जामिनेशन ऑफ सेलुलर एलिमेंट इन द ब्लड। नेक्स्ट क्वेश्चन, elevated levels of creatinine in blood test are often indicative of, correct answer kidney dysfunction. The erythrocyte sedimentation rate ESR is a measure of, क्या होता है, इन्फ्लामेशन इन द बॉडी। बॉडी के इन्फ्लामेशन के बारे में यह हमें डायग्नोस करते हैं, सूचित करते हैं। Which enzyme is commonly measured to assess liver function? Correct answer aspartate aminotransferase AST. The terms हिमेचुरिया रेफर टू, हिमेचुरिया का मतलब क्या होता है? तो ये होता है फ्रेंड्स यूरिन पे ब्लड का पाया जाना, अर्थात करेक्ट आंसर प्रेजेंस ऑफ ब्लड इन द यूरिन। करेक्ट आंसर नंबर इज बी। A high level of troponin is blood test is indicative of, correct answer myocardial infarction अर्थात हार्ट अटैक। The terms polyuria refers to, polyuria का मतलब होता है अधिक मात्रा पे यूरिया अर्थात excessive urination। आंसर नंबर इज बी। मेरे को सर्दी पकड़ लिया है बेटा, सुसु करेगा। शू 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 शू। चलेगा, निकलेगा। भूख लगा है, भूख लगा है बेटा, यहाँ भूख लगा है। मेरा बेटा को भूख लगा, भूख लगा, भूख लगा, भूख लगा, भूख लगा, बेटू को भूख लगा, भूख लगा, भूख लगा, भूख लगा, भूख लगा, भूख लगा, भूख लगा। भूख लगा, भूख लगा, मेरा बेटा को भूख लगा। What does the prothrombin time patient measure? PT prothrombin time measure in blood clotting test. Correct answer is the intrinsic pathway of the coagulation. Ha 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 ha. टू टू टू। नहीं, हाँ आ गया शायद, नहीं आया है, नहीं आया है। दिख नहीं रहा है रंजना, चला नहीं पता चल रहा है, चला के देख चालू करके। यहाँ से तो नहीं दिख रहा है। हम्म? हम्म। हम्म? किया था उसमें। खांसता हूँ चाहे नाक पूछता हूँ तो देखता है तो।
सर्दी सर्दी बेटा, मम्मा को भी सर्दी है ना, कब बोला था?
मत बोलना, बाबू को नहीं होगा। बाबू को नहीं होगा सर्दी, बाबू स्ट्रांग है ना मेरा बेटा, तू स्ट्रांग है ना सर।
रोना, रोटी खा रही हूँ। नमक दे दो, नमक दे
काहे पहन रही पैजामा, खाली चड्डी चड्डी में रहना, वो विदेशी लोग जैसा ना मेरा बेटा। मम्मी को आज विदेशी बना देते हैं एक दिन के लिए, है कि नहीं? हूँ कह रहा है। बिलेती, बिलेती बना देते हैं। आए 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 ओए ओए ओए। हम्म 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 हम्म। मशीन सुनाई नहीं दे रहा है ना, मशीन सुनाई देता तो हम लोग का ही कट रहता। मशीन वहां चल रहा है, क्या बोलते हैं, पानी टंकी के ऊपर को प्लेन उलेन कर रहा है। हाँ, कुछ छड़ वड़ निकला होगा ना, उसको काट रहे हैं तो छेदा नहीं कर देगा टंकी को।
तो बोर मत कीजिएगा।
तो बोर वहां नहीं करेंगे, यहाँ इसी हैंडपंप में जोड़ेंगे।
ये वाला
हाँ
मशीन लगा दीजिए।
हाँ। ना बेटा, ना बेटा।
पूरा चार्ज ना होगा रोटी।
बेटा शटर को खोल दो।
लला आज बहुत जल्दी सूत गया बेटा, बहुत जल्दी सूत के उठ गया लल्लू। ड्रम में पानी है, ले जाइएगा ग्लास आधा पानी को नहा लीजिए। तो पीने के लिए भी है,
नहाएगी।
धो लूंगी तो तेल लगाऊंगी बाबू कपड़ा को, अभी नंगू पंगू छोड़ दूंगी। थोड़ा सा धूप है कि कपड़ा सा खोल दूंगी, नंगू पंगू के लगे ना बेटा। रोटी खाएगा बाबू, अभी मिस रही हूँ बेटा। ठपठुप 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 ठपठुप। हाँ हाँ, ऐसे खेलेगा बाबू, ऐसे खेलेगा। लूढ़ा जाता है रे बाबू, लूढ़ा जाता है। तेरा चुत्ता नहीं मारता है बेटा, तेरा चुत्ता नहीं मारता है ना। ओके है ना,
उठा देती है ऐसे रोज तेल मालिश करके।
तो चौथा रहता तो पैंट पहनता तो निकल।
पैंट किसे निकलता?
तो नहीं रहेगा चुत्ता तो ना बाबू। वैसे काहे उठाते हैं लेकिन ना। ले बेटा, एक तो रोटी है, एक तो
चम्मच कहीं
लाल पानी चम्मच बांटने वाला भी काम हो गया।
उसे खिलाना, उसे खिलाना, मिठाई।
ले बाबा, हाँ जरा ले दूध रोटी। ले बेटा, खा ले, बुर 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 बुर। ले ना बेटा, खाओ। कैसी बेटी खाएगा।
Next, a blood gas analysis of obtained performed to access characterization acid-base balance and oxygen level in the blood. Next, which electrolytes imbalance is associated with muscles weakness, cardiac Next, the terms leukocytosis refer to an elevated count of characteristic white blood cells. Which of the following is a tumor marker often elevated in prostate cancer and is used for monitoring to disease. Answer number B. PSA, prostate specific antigen. A blood test measuring level of thyroxine T4 and triiodothyronine T3 is used to assess the function of which gland? Correct answer, thyroid gland. In the context of blood clotting, what does the terms INR stand for? INR means International Normalized Ratio. Next, the MCV, mean corpuscular volume, is an complete blood count. CBC measures the average volume of red blood cells. Correct answer. What is the purpose of a bone marrow aspiration and biopsy? Correct answer. Diagnose anemia and blood disorder. Which of the following condition is associated with an increased level of bilirubin in the blood? Correct answer number is C. Jaundice. A blood test measuring level of anti-nuclear antibodies is often used to the diagnosis of. Correct answer number is B. Systemic lupus erythematosus, SLE. A blood test measuring level of B-type natriuretic peptide BNP is used for the diagnosis and monitoring of. Correct answer, heart failure. Which of the following is a common test used to evaluate kidney function and is a measure of glomerular filtration rate, GFR? Glomerular filtration rate. Correct answer, serum creatinine. The terms hemolysis refer to. Correct answer is A. Coughing of blood. Next, what is the primary function of the international normalized ratio? Is blood clotting test. Correct answer number is C. Standardized prothrombin time across different laboratories. Correct answer number is C. Next, a fecal elastase test is commonly used for the diagnosis of. Correct answer number is A. Pancreatitis. What is the primary function of the C-reactive protein CRP in blood test? Correct answer is C. Indicating inflammation in the body. Next, which electrolytes imbalance is associated with muscle cramps, weakness, and cardiac arrhythmias? Correct answer, hypokalemia. Next, the terms thrombocytopenia refer to a deficiency of. Correct answer is C. Platelets. A sputum culture and sensitivity test is commonly performed to identify the cause of. Correct answer is B. Respiratory infection. The reticulocyte count measures the percentage of. Correct answer is A. Immature red blood cells. Which of the following is a test used to assess the function of the exocrine pancreas and is often elevated in conditions like cystic fibrosis? And correct answer fecal elastase. What is the primary purpose of a rheumatoid factor RF test in ब्लड एनालिसिस? आरएफ किसके लिए किया जाता है? तो यह आइडेंटिफाई ऑटो इम्यून डिसऑर्डर पार्टिकुलरली रिमोटॉइड्स अर्थराइटिस के लिए किया जाता है. The presence of which antibody is often tested in a serological test for infectious mononucleosis? Correct answer is IgM, immunoglobulins mu. Next, ACSF, cerebrospinal fluids analysis is commonly performed to diagnose conditions affecting the central nervous system. The terms hyperglycemia refer to elevated level of, correct answer, glucose in the blood. हाइपरग्लिसेमिया कहलाता है ग्लूकोज लेवल का बढ़ जाना और घट जाना हाइपोग्लिसेमिया होता है. A test measure level of thyroid stimulating hormones TSH is primarily used to access the function of the, correct answer, pituitary gland. The terms dyslipidemia refer to abnormalities in the levels of, correct answer number is D, lipids in the blood. सजना मेरा रुमाल कहाँ करी? जींस में कल लेके गया था उसको. अरे कल पकड़ा था उसको. अरे लाल को तो धोया होगा जी. मेरा वाला रुमाल तो आज कपड़ा साफ कर रही थी तू मेरा. हाँ तो पैंट और कोट मैं सोचा पैंट में होगा तो तू रखी होगी, नहीं तो कोट में रहेगा, मैं तो जान रहा था. Which of the following is a common test used to access coagulation factor in monitor anticoagulant therapy? Correct answer prothrombin time. The terms erythropoiesis refer to the production of, correct answer, red blood cell. A blood test measuring level of alpha fetoprotein AFP is commonly used for the screening and monitoring of pregnancy associated complication. The Schilling test is used to diagnose deficiency in which vitamin? Correct answer number is vitamin B12. A blood test measuring level of anticyclic citrullinated peptide (anti-CCP) antibodies is often associated with the diagnosis of. Correct answer is C. Rheumatoid arthritis. Which of the following is a tumor marker commonly elevated in ovarian cancer? Ovarian cancer के लिए तो CA-125. A blood gas analysis is often performed to assess. Correct answer acid base balance and oxygen level in the blood. Next, the terms hemolysis referred to. Option number A, formation of blood cells, breakdown of red blood cells, clotting of blood, and increase in white blood cell count. Correct answer, breakdown of the red blood cells is hemolysis. Next, a blood test measuring level of carcinoembryonic antigen is commonly used for monitoring. Correct answer, cancer recurrence, especially in colorectal cancer. The terms oliguria refers to. Option number B, decreased urine output. A blood test measuring level of lactate dehydrogenase is used as a marker for. Correct answer is C, cardiac injury and tissue damage. The terms thrombophilia refers to a tendency for. Correct answer is B, blood clotting disorder. Next, a blood test measuring level of cortisol is used to assess the function of the. Correct answer is B, adrenal gland. कुछ भी चीज का, ठीक ना, चटनी बस होना चाहिए। एक बार ऐसे ही हम लोग गए थे, उस समय मामी चटनी बनाई थी, तो उन्हीं कहेगा और सारा चटनी को एक बार दे दी, ठीक, उनके लिए जितना बनाए थे। उन्होंने कहा आदत था परसा लेके खा लेते, जितना ज्यादा चटनी दी थी सबको खा के खत्म कर दी। अब मांग रहे हैं तो चटनी है ही नहीं, इतना गरिया है, इतना गरिया है ना।
हाथ लगे, नहीं 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 बेटा, नहीं लगा, नहीं लगा, सुना को नहीं लगा।
तो नानी बोली जानते तो हो कि इनको परसा चाहिए, तुमको बचा के दे। नाना को शुरू में थोड़ा सा दो, कोई दिक्कत नहीं है, दोबारा में दे दो सब।
मत लगा, लगेगा हाथ को, नहीं पटको, नहीं पटको। ओ झुंझुना को दी, ए इसको ले बेटा, इसको नहीं छोड़ेगा उसको, तब देखिए ना। मुझे फटाफट अच्छा लग रहा है चटनी, कितना हो गया?
ठीक है, चटनी तो सही लगी थी।
इसको इसके साथ बहुत टेस्ट होता है, ये चटनी करना। क्या चीज अभी एक तो चड्डी गंजी वहां लेके रख दीजिएगा।
एक तो बैग रखेंगे वहाँ, ठीक ना, छोटा सा, उसमें हम लोग का कपड़ा, चड्डी गंजी कपड़ा और वो चीज रहेगा, बस।
कभी इमरजेंसी में गए तो नहीं, आदमी निकाल के रख दे तो एक बार दूसरे कपड़ा होना चाहिए घर में, है कि नहीं? बाबा नहीं ठीक। हाँ
नाक बह रहा है, इस चटनी खाने से नाक बहने लगा। और शादी ब्याह का सीजन आ रहा है। बिन्नी का शादी लगे तो वही तो करेंगे ना इन लोग, धर्मशाला उसी में ना।
मेरे को लगता है ना बिनी को पसंद है, वही नंबर भेजी है, उसमें नहीं जाएगा।
हो भी सकता है।
बहुत भीड़ होती है, कैसे जगह में, कैसे जगह में है, मुझे घाट रोड में है, मतलब बोरिंग टाइप से नहीं लगेगा, है कि नहीं?
वो कह रहे हैं ना लंबा फैमिली है, कुछ दिन बाद फैमिली छोटा हो जाता है, समझी।
घर को गई डब्बा देकर
पीछे तो लंबा है टीका।
हाँ पीछे तो
अब तो भैया के साथ अलग ही हुए हैं, तो लेकिन अभी भी अलग जैसे रह रहे हैं ना, हम तो अभी साथ में ही है, जबकि हम लोग हुए तो फैमिली अभी एक में ही है, फिलहाल साथ में ही है, वही होता है।
अरे यार चल ले मुंह में डाल के पोगी।
ये बोला तो इसका बोलिए।
कौन
याद से व्हाट्सएप करना उनका कार्ड को ना।
मेरा नाम बताएगा, नीतू नाम से मेरे को जानते हैं, नीतू नहीं बोलते
नहीं मैं कार्ड को भी रखे रहूंगा, वैसे तो मैं तेरे को व्हाट्सएप करूंगा। हाँ तो नंबर को ही भेज दे, मैं कार्ड में भेज दूंगा। मैं तो सोचा नंबर को सेव ही रखी होगी, इसीलिए कार्ड।
नहीं, आप बात करती हैं तो मुझे से
हाँ ठीक, हाँ ठीक है ना, तो उसको मतलब वैसे भेज देना उसका नंबर।
मैं उनको एक बार फोन करके बता दूंगी कि एक फ्रेंड है आपको बेटा का ऐसे तो प्रॉब्लम है,
हाँ
वो व्हाट्सएप करेंगे आपको।
नहीं नहीं, मैं तेरे को ही करूँगा, मैं तेरे को ही करूँगा।
अच्छा ठीक है, मैं बात कर दूंगी ना।
हाँ
अगर मिलने के लिए बोलेंगे ना तो आप इधर एक बार मिल लेना।
हाँ हाँ हाँ
मैं भी चली जाऊंगी खाना।
हाँ ठीक है ना। मैं सोच ही रहा था, जैसे वो डॉक्टर बोली थी ना वहाँ वाले क्या बोलते हैं, सुनीता सोनोग्राफी जो करती है ना मैडम, मतलब एक जेंट्स करता है बट बच्चे इसको इको के लिए बोला तो एक डॉक्टर मैडम आई थी चाइल्ड वाला ही, तो वो हार्ट स्पेशलिस्ट ही है, तो बोली कि 6-7 महीना बाद फिर से आके कराना, तो देखेंगे उस समय कि कम हो रहा है कि नहीं हो रहा है करके। इसका क्या है ना कि जो राइट आइट्रम है ना, राइट या लेफ्ट या राइट कंफ्यूज नहीं हुए, वो आर्ट्रियम का मतलब उसमें जा रहा है, क्या बोलते हैं दोनों शायद राइट वेंट्रिकल वेंट्रिकल का है, वेंट्रिकल टू उसका वेंट्रिकल वेंट्रिकल टू वेंट्रिकल के बीच में छेद है ना, तो उसी को VSD बोलते हैं, वस्कुलर कुछ करके, तो उसी को अब एक बार दिखाना है।
हाँ एक बार दिखा दीजिएगा, आते तो रहते हैं। फर्स्ट सैटरडे या सेकंड या थर्ड में मैं पूछूंगी कि फिर आप कब आओगे तो बता दीजिए।
ठीक है ना, मैं तेरे को उसको व्हाट्सएप करूंगा, इसके बाद उसको व्हाट्सएप जैसे वो उसको देख लेंगे है ना, इसके बाद फिर बताएंगे ही ना कि मतलब एक बार मिल लेंगे, और जैसे भी तो आऊंगा फिर मिल लेंगे।
क्या हो गया? रायपुर जाने से अच्छा यहीं पे बहुत लोग तो यहीं पे दिखाते हैं। मेरे फ्रेंड के हस्बैंड को भी करता तो यहीं पे मैं बोली, वो मेरे पास ऐसे मिली तो फिर दुनिया की मैं बोली क्या हुआ तुम लोग को, तो बोलती है मेरे हस्बैंड का दिल में बीमारी है, ये है वो। मैं बोली यहाँ पे एक सर आते दिखाना, फिर उन्हीं को दिखाया तो वही ट्रीटमेंट कर रहे हैं। रायपुर महाराष्ट्र में दिखाया तो अभी यहीं से दिखा रहे हैं।
मेरे को उस समय जहाँ बाबू हुआ था ना, तो डॉक्टर बोल रहा था कोई शैलेश गुप्ता ही है करके, ठीक है, यहाँ जो उसी में क्या बोलते हैं संकल्प में, तो फिर वो नंबर दिया है एक तो वहाँ का जीवन ज्योति में आता है बोला, रायपुर से ही, तो फिर अभी मैं बोला कि डॉक्टर कहानी क्या बोलेगा, ये डॉक्टर बोली 6 महीना बाद करना, इसीलिए मैं नहीं गया। मैं बोला डॉक्टर लोग डरवा दिए रहते हैं, तो थोड़ा सा अभी बाबू के साथ है, थोड़ा माइंड को पॉजिटिव बोला रहेगा, है कि नहीं, इसीलिए हाँ इसीलिए मैं नहीं गया। और बाबू को अभी तक तो हम लोग एकदम अच्छे से ही रखे हैं, समझ रहे ना, ज्यादा बीमार पड़ने नहीं दिए, एकदम केयर तो इसको अच्छे से किया हूँ ना। बाबू भी मतलब अभी ठीक ठाक ही है, मतलब सर्दी खांसी हल्का फुल्का पकड़ता है तो ठीक कर लेते हैं।
ठीक है ना, तो मैं बात कर लूंगी सर से। मैं तो कुछ भी रहता है, मेरे को भी प्रॉब्लम रहता है ना, तो वही इसको दिखाती हूँ मैं, उनको समझाती हूँ सर मेरे को ऐसा लग रहा है, वहीं से मेडिसिन लिख देते हैं मेरे को। प्रॉब्लम रहता है वही को बता देती हूँ। अब तो हमारे यहाँ भी गाने डॉक्टर आ गए, वही डॉक्टर देख रहे हैं। वही डॉक्टर है, उनके पापा को भी प्रॉब्लम था, तो फिर उन्हीं के पास प्रसाद दिलाओ इसलिए प्रसाद दी उन्हीं को। नंबर की बात की, फिर मिलने बुलाया, फिर मिलने गए, फिर बोली कि नहीं है मैम, कुछ नहीं होगा। देखिए बाबा आ जाओ आ जाओ।
ठीक है, फ्री रहना तो फोन करना यार, एक आध दिन हम लोग यहाँ भी घूमने आओ।
ठीक है ना,
हाँ बेटा से मिलने भी आ जाओ। हाँ
चूस कर करते हैं ना, अटकना नहीं 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 देखो। ठीक है फिर,
ठीक सुशीला, ठीक हाँ।
खायचे बाबा, खायचे खायचे बे।
व्हाट्सएप उसको फाइल को खोजना है जरूर ना, और बनाता हूँ उसका फाइल और तेरे चाचा को भेजते हैं, इसको ठीक है ना, कहीं पता चला दोनों जन एक ही डॉक्टर को कोई भेज दिए तो चाचा फ्री तो होंगे ना कि कहीं पत्नी भाई से अभी रोज रात को पैग मार गया और टाइट वही टाइट कोई और लड़की ने काटा तो मैं क्या कमाता हूँ तो मैं ही तो काटा हूँ ना बेटा। नाना जी देखो तो तेरे को गोदी भी नहीं किए ना रे, ध्यान ही नहीं दिए, इतना बिजी थे।
कोई बात नहीं, चलता है।
कितने तो ना 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 बेटा, वहां तो तेरे नाने नाना भरे थे।
नाना के पापा, फिर पापा, नाना, नाना, नाना के पापा पर नाना। नहीं करेंगे बेटा ज्यादा ना,
मुझे यार हो अपना भी 150 क्वेश्चन और कुछ है
कैसे बनाएंगे इसको?
सटासट मारे
बोल के उतना बनाएंगे हम। कितना टाइम लगेगा? 1 घंटा। कहाँ में लग गया लल्ला ये चोट? लाल हो गया का का का? देखो तेरा कपड़ा कैसे हो गया। कब करवाएंगे जानू बाबू को? कब जाएंगे हम लोग? का आ लल्ली आज
क्या 10 तारीख को चलते हैं।
आज क्या तारीख है? 4 है। 3 4 है। इतना हुआ 3 लगता है। कहाँ मेरा थे मुझे कहाँ पे मेरा ए यार कहाँ चाहता है देख रहे उसको मिल रहा है नहीं।
थोड़ा सा थोड़ा
मामा पानी कर रहा है एकदम। कहाँ है फाइल में नहीं दिखा। लाए कौन समय?
अच्छा जाओ पर अलमीरा ऊपर तो से एक जगह तो होगा। 3 बजे तक वीडियो कैसे भी हाल में कंप्लीट करना है। 2:18 हो रहा है। इसके बाद 1-1.5 घंटा उसको ओची होने में लगेगा, मतलब सेव होने में। इसके बाद तो अपलोड का कोई टेंशन नहीं है, कितना हो टाइम अपलोड कर लूंगा। 1 घंटा 1.5 घंटा लगेगा वीडियो को रिकॉर्ड जो किया हूं ना उसको सेव होने में। ठीक सेव हो जाएगा तो फिर डाल दूंगा तो अपलोड तो हो ही जाएगा बोल रहा हूँ। Which immunoglobulins class is primarily involved in serological reaction. Correct answer IgG. Next, in blood typing, the presence of which antigen determines the above blood group. Correct answer is A and B antigen. The rapid plasma region test is commonly used for the diagnosis of which disease? Correct answer is syphilis. Which of the following is confirmatory test for HIV? Western blot is the confirmatory test. What is the purpose of the Kumbh test in serology? Correct answer detection of autoimmune hemolytic anemia. Which serology test is commonly used for the diagnosis of infectious mononucleosis? Correct answer monospot test. What is the primary purpose of rheumatoid factor test in serology? Correct answer diagnosis of rheumatoid arthritis. The Qualung's reaction is the serological test used for the identification of which type of microorganism? Correct answer bacteria. Which of the following is a confirmatory test for hepatitis C infection? Correct answer HCV and RNA PCR. In blood grouping, which blood type is the considered universal donor? O negative is universal donor. What is the positive rheumatoid factor is test indicates? Rheumatoid arthritis. The Montauk test is a type of serological test used for the diagnosis of. Correct answer is tuberculosis. The quantiferon TB gold test is used for the diagnosis of. Correct answer is B. Tuberculosis. The HCG human chorionic gonadotrophy test is the commonly used for. Correct answer is pregnancy testing. The Vidal test is the commonly employed for the diagnosis of typhoid fever. The rapid antigen test is the frequently used for the rapid detection of. Correct answer is influenza. The HbA1c test is not a typical serology test but the commonly used for monitor to. Correct answer is answer number B. Blood glucose level over time. The anti-DS DNA anti-double standards DNA test is associated with the diagnosis of. Correct answer lupus erythematosus. The AFP alpha fetoprotein test is the use for screening and monitoring of. Correct answer is liver cancer. The TSH test is the commonly used to access. Correct answer thyroid function. Which serological test is the commonly used for the detection of antibodies in the diagnosis of autoimmune disorders such as myasthenia gravis? Correct answer number is A. Anti-TPO, anti-thyroid Read play peroxidase test. The anti-Jo1 antibody is the associated with. Correct answer poliomyelitis. The T-spot TB test is the used for the diagnosis of tuberculosis. फ्रेंड्स पैथोलॉजी से रिलेटेड 100 क्वेश्चंस है। ये हमारा 100 क्वेश्चंस जो है ये लास्ट हो जाएगा। आप यहाँ देख सकते हैं। मैं चलिए एक बार नीचे स्क्रॉल करके आपको दिखा देता हूँ। तो यहाँ 100 क्वेश्चन जैसे ही लास्ट होगा तो आप यहाँ ब्लड बैंक के 50, सिकल सेल के 40,